So what I'd like to do now is introduce Dr. Felix Liao. Is a thought leader and a healthcare innovator with 3 evidence-based books and Start Thriving appliance to his credit. He bridges the medicine-dentistry divide by connecting airway and sleep with the maxilla and the tongue, and offers epigenetic solutions with documented outcome. In his new book, License to Thrive, released in January of last year, Dr. Felix shows how to build vibrant health and innate immunity by mouth. In practice, Dr. Felix helps patients mitigate, resolve chronic pain and fatigue and any symptoms of oral origin, redevelop jaws and airway, restore sleep, and recharge energy. And on the weekends, Dr. Liao trains interested dentists to do the very same. Welcome, Dr. Liao.
Thank you, Shelby. Well, thank you for your interest. We have a packed program for you, so without further ado, let's go. So this is going to be a drive-by bus tour. We're not going to get in great depth. I'll just show you what's possible and why the earth is no longer flat in dentistry, okay? So I am not affiliated with any company. If you take my training, I get paid, but you don't, I don't get paid for if you use my appliance. I developed my appliance simply because I wanted the simplest, the most efficient way to treat and do the right thing. Okay, so here we go. So after the pandemic, this is the best time to evolve your practice from teeth to mouth. Let's face it, dental school teaches us to be great tooth doctors. This is the time, as Dr. Moralia said this morning, to start thinking about jaw, growing the jaws, okay? So dentistry is hard on your body, all right? And I'm going to show you an easy way. The easy way will make you a lot happier, make your patients a lot happier. Imagine not starting an appointment with a numbing cream and an injection, all right? So this is the way I practice now. I no longer bend over the patient, and my overhead consists of a Dremel tool. I can work out of a barber chair if I so choose, okay? So this is the easy way, the smart way, I believe, to become a dentist in the 2020s. Now, in order to do it that way, you have to know more than just teeth. You have to know that the mouth is the source of illness, okay? At the same time, it's also the root of wellness. Give the body what it needs, which is alignment, breathing, circulation, energy, digestion, energy, sleep, by mouth, and it will thrive. I mean, what is the mouth for? The mouth is for us to make energy, okay? Eating, sleeping, breathing. And for that, you need a structure that will work to carry out these functions. What if it's not working? All right? Well, here's what happens when it works. You get beautiful faces, and you get radiant health. This is what the mouth is designed to do for the body. All right? This is 2 years' time. And for those of you who are rooted in the mandibular advancement devices, I have news for you. The center of the universe is around the maxilla. Okay? The propagation of mankind is centered over the maxilla. Notice that the nose is nothing but a tunnel through the maxilla. And we all know that under these zygoma, there is what? The maxillary sinus. Okay? So the maxilla is a game changer. Once you focus on this, dentistry is no longer in the flat earth mode, okay? So what happens when the mouth is structurally impaired, okay? By that I mean a deficient maxilla. By that I mean a tongue tie. By that I mean a nasal obstruction, okay? So an impaired mouth syndrome is anything that originates in the mouth. Medical symptoms, dental symptoms, mental, emotional symptoms. anything that requires the mouth to work fully, it's not there, okay? So I listed these because I've treated every one of these conditions. Okay, we made a positive difference with this maxillary development approach. I'm going to put this out so that it doesn't make that rustle sound. All right, so an impaired mouth syndrome is oral contributions to any symptom that starts from the mouth structure or the mouth usage or both. So today, the title of the talk is Expanded Treatment Plan, okay? The expanded treatment plan starts with an expanded skill set. So my job today is to help you see beyond the 2 rows of teeth, beyond tooth number 1 to 32, beyond the 2 TMJs, okay? I want you to be able to assess the patient from head to feet and birth to now, and be able to tell what kind of a burden their body is carrying. So this is going to be a fast bus tour on growing new eyes, diagnose root cause that is in the mouth, and offer health and wellness because that's what your patient wants to buy from you. We're going to talk about ABC before D. There are lots of implant manufacturers who want you to use their implants. What do you need to know first in order to ensure success and not have to deal with failure, okay? And then what do you still not know that you must know before you do anything on teeth? So here's a useful rule of thumb that has not failed me yet. Turn to your next door neighbor and look at them in profile. Anyone who's got a lip that drops straight down, the airway is at risk. This is a rule of thumb. It's not yet a law, okay? But when you see someone with a flat upper lip, or worse yet, it curls inward, that means that the maxilla is retruded. Anytime you have a retruded maxilla, you have an airway that's obstructed. The jury is in, okay? Disorder of oral facial growth is what contributes to pediatric obstructive sleep apnea. Stanford Sleep Center, okay? Now, what is adult sleep apnea by pediatric obstructive sleep apnea not diagnosed under the watch of dentists all the decades? So I'm out on a crusade to convert as many dentists into airway center mouth doctor as possible. And thank you for being here. So this is the dream job I've created for myself. And this is a dream job that you could adopt yourself. I've been a general dentist for 40 years and biological for 25 of it. And guess what? I'm having the best time of my life because all my women patients come back looking more beautiful. Seriously. And all my male patients come back with more energy, okay, which is way in short supply. All right? And I run a program to train dentists on how to become airway center mouth doctors. So I do have an appliance, and this appliance is here only because a lot of people are asking me about it, and I use it for everything. Everything, because it's simple, it's versatile, and reduces the need for orthodontics, as Dr. Ben Morelia beautifully showed this morning. It's the jaws that you need to grow. Okay, as Stanford Medical Center says, failure of oral facial growth. Okay, and what is it, I ask you, that grows the jaws? It's the mouth. All right, become a mouth doctor. Get really proactive. Okay, so I use it for all these things. not just sleep apnea. I completely agree with Dr. Denbar. All right, if you try to take over a sleep apnea case, you're at serious risk. I believe in staying within your scope of practice, which is oral contribution to any medical, dental, mental, emotional symptom. All right? So, no claim on sleep apnea, okay? I will treat CPAP intolerance because that's an indication. I will treat poor sleep, I will treat chronic fatigue, and believe it or not, scoliosis also requires an oral contribution to be evaluated. So here's how my appliance works. It's basically a maxillary appliance that addresses the maxilla while allows the mandible to come forward. 2 or 3 in one. And the third one is they don't need orthodontics. All right? So this is called Liao's groove. It's a parking spot. I tell the patient, your lower incisors, just come here and drops in. So it goes from here, a big overjet, and it drops in there and stays there. Then that triggers a growth and development process epigenetically. It blows wind in the cell of the double helix DNA expression. And this is the same child, same day. I asked the mother to take a picture. Okay, same child, same day. In the parking spot versus pre-treatment. And every one of my appliances goes out, that goes into the patient's mouth, gets a bone-building diet to go with it. Failure of oral facial growth means you need to give the kid a bone-building diet. Standard American diet, pizza delivered to your door is not going to do it. French fries and burgers not going to do it. Okay? So this is green smoothies, the best of plant kingdom. This is turkey wings under a bed of vegetables. Okay? Just stew. That's it. I plug it into a crock pot, $19.99 from Target, and the next morning I got bone broth. Even a bachelor can do it. So when you take turkey soup out of the fridge the day after Thanksgiving, it's rich in gelatin. It will grow bone. And I'm from Taiwan. We eat beef rib soup all the time. Just throw lots of vegetables on there. Okay? And we emphasize seafood because of the iodine and the ocean minerals. So here's Liao Sign. This is one of our own dentists. She came in with obstructive sleep apnea. Okay, and you can tell that from this Liao sign right here, her airway indeed is in the red zone. So for those of you who are seeing this for the first time, white on the color scale means 6-lane highway. Red means 1. Black means you have a country lane, angel hair pasta, okay? And with cone beam CT, you do need a cone beam CT to do this work. And believe me, it's well worth it because once the patient sees this, they're going to say, what do I do now? And it will sell the cases for you. And when I say it sells the cases for you, you are doing them the favor. Help them to say yes to what their health needs. That's what I call a professional service, okay? So this dentist has all this pain pre-treatment. You do need a 15 by 15 field of view. The one that just does the implant won't do it. You need the one that will cover from here to here, here to here, and here to here. And this way we can disclose where the kink in the neck is. That's why she had the neck and shoulder pain, okay? Her dental midline and her spinal midlines, represented by 2 different colors, do not coincide. This is a source of pain. It's a guaranteed formula. And it will stay in pain until somebody makes this diagnosis. So she was born with a rotator cuff injury when she was pulled out of the birth canal. All kinds of physical therapy and rotator cuff surgery didn't help her. All kinds of PD didn't help her until we gave her a DNA appliance. Properly designed, that's the key word. Any appliance that is properly designed will work, okay? And now you can see that we made more difference than all the other treatment combined. She also told me that she was able to lose 110 pounds and hold it because she can sleep better. Just small detail that your patients who are obese understand that they're victims very often of airway obstruction that's not diagnosed. Victims of impaired mouth syndrome that's not diagnosed. Okay? We're empowered to do this work by no less than the U.S. Surgeon General, the highest ranking medical officer in our land. Oral health is more than healthy teeth. It's time to grow jaws. It's time to grow the face. So I'm indebted to Dr. Singh, G. Dave Singh, who taught me about functional airway spaces. Zone 1, nasal cavity. Zone 2, nasopharynx behind the soft palate. Zone 3, oropharynx behind the tongue. And zone 4, of course, is what we look into every day when we check the hygiene patients. Okay? All 4 zones must be wide open, fully developed. And so what we do, we should be upper airway diagnosticians. I'll show you how to tell besides the Liao sign. How to tell. You get to become the facial architect. Okay? You get to change people's faces in a positive direction. And you're going to become a craniofacial orthopedist that's going to take them out of pain for good. I'm talking about the oral contributions, okay? So here's Liao's sign curled inward. Look at this airway. Here's Liao's sign. Look at this airway. What happens when you treat it the right way? She's going to tell you.
Okay, hi, I'm Kimberly Small, and I give Dr. Liao permission to use this for training purposes. I wanted to talk about how much more energy I have now after this treatment. I used to come home from school. I'm a special education teacher. I would collapse on the floor. Well, it was a planned collapse for about 10 to 15 minutes where I would have to recharge my energy in order to continue with my day because I was so exhausted. And now I don't need to do that anymore. In fact, I've taken on a new training in addition to my work. So now I'm becoming a Pilates teacher too.
Wow, congratulations.
Thank you. Yes, it's wonderful to have more energy.
Yeah. You've been a great patient. Thank you for sharing your experience with us.
Thank you.
So here's what she looked like before she got started, okay? So we're talking about expanding our what? Dentist eyes to see beyond 2 rows of teeth, okay? Look at this set of teeth. What can you put on your treatment plan besides 6-month recall? Maybe a buccal pit here. Now it turns out, okay, cosmetics is not her main thing. If you know how to ask the right questions, they will tell you it's pain, TMJ, crooked teeth, and daytime sleepiness for 20 years. Now, this maxilla and mandible, in between them is the oral cavity that's a home office for your tongue. This tongue has no place to be in the mouth. It had to be forced into the throat in order to exist. That's what explains this. So I developed this technique called 3D jaw diagnostics because I was just curious when I got to dental school, why teeth grinding? And I searched high and low, inside, outside dentistry, took all kinds of courses, you name it, I did it. Along the way, I studied some orthodontics. I learned Schwartz model analysis. It tells you the transverse, side-to-side relationship between the maxilla and the mandible based on the width of the 4 upper incisors. Based on that, you can calculate how the maxilla and mandible should relate to each other, front and back. So you can see everything is deficient. Now we know what to do. We need to develop her transversely. And that deficiency has downstream consequences from the mouth to the rest of the postural chain. All right, so 3D jaw diagnostics means transverse, side to side, and then this is called a Sassoon plus cephalometric analysis. It gives you the vertical and the AP. So you got 3D explaining why this is. All right, so I tell patients, this is like an architectural blueprint of your craniofacial skeleton that's home to your tongue and your nose for breathing, okay? So she has what I call impaired mouth syndrome. She has oral contributions to all her symptoms, medical, dental, and mental emotional. The fees, since we're talking about expanding treatment plans, ranges from $7,000 to $9,500, and the treatment lasts 2 to 3 years. And each visit, I just spend about 15, 20 minutes with them. And I see them every other month. So this is what the appliance looks like in the mouth with Liao's groove. And so when the patient is done, they're in the as if class 1 incisal relationship. And look at the lower anteriors. Same mouth. All right, we can just use clear aligners and we're done. We hardly have any orthodontics to do. All right, so on the lower, we have these things called lingual sweep springs that as the gear expands, they sweep so that the lower anteriors lines up beautifully into an arch form like this. That's it. It's not rocket science, except we got to grow our silo mentalities, the dentist tunnel vision eyes, into seeing the whole patient and knowing how the mouth fits into the entire body. You know, the brain is hardwired for this, hand-to-mouth existence. All right? This is also the main route of transmission for what? The coronavirus and the main route of transmission for cardiometabolic diseases that's killing most Americans today. So every one of your patients needs a mouth doctor. So much better if you know how to help them with their airway. Okay? So this is the best time ever to become an airway mouth doctor. 93% of your patients and 93% of you in this room need this help. So what better yet, you can learn to do this and treat yourself and turn around, offer it to your patients. Within a 20, 30 mile radius, there are not nearly enough airway center mouth doctor to treat these cases. Okay, once you get trained, you can look forward to a career of total joy. Now, here's another way where you can tell the patient's nasal passage is in trouble without looking past their lips. The first thing I do when I meet a new patient is, of course, take the intake interview and do a history, in which I find out whether their issues has got a match with my solutions. When I start doing a physical exam, the first thing I do is I listen. I listen to them. Breathe. Thank you. All right. So the first thing I do is I would just put my ear next to their mouth. So they're looking this way. I'm looking that way. And I said, close your lips together and inhale. And so here's what happens.
Can you just breathe through your nose, please?
Let's look at this part here.
Good. Now block one nostril, like we did earlier.
I'm listening.
Inhale, strongly.
I'm listening for obstructive sound.
Two. Same thing the other way, please. Good. Now let go. And I want you to snort very quickly. Like this.
They don't know how.
Again. Harder.
Do you see the collapse there? Yeah. So I already know that this patient has nasal obstruction as a result of deficient maxilla in the transverse dimension. All right. So why is that important? Because nitric oxide is released systemically through nasal breathing. All right. This is how I can tell whether they are hardwired because they don't have enough nitric oxide as a result of habitual mouth breathing. Okay, it turns out that nitric oxide acts as a airborne messenger to relax the bronchial and the respiratory trees. Okay, if you're not breathing through your nose, if you're snoring, then you can expect that you're going to have higher blood pressure. So that nitric oxide has a vascular relaxation effect, okay? And this helps, along with deeper sleep from wider airway, took away this gentleman's erectile dysfunction. How? Because we doubled the narrowest cross-section from 123 here to 225, doubled. So combination of nasal breathing by widening the maxilla. So do this now, every one of you. Sit up and just sit up straight and take a breath in and out. Don't raise your chest. Just nasal breathing without raising your shoulders. Now, put your fingertips, index fingertips on either side of your nasal curvature and just spread it out 2 millimeters, not much. Now inhale, out a little bit more to the side, sideways. Yeah. Do you feel more? All right, so it's 1.2 to the fourth power. That's twice. If I give you 20% more width here, you will get twice as much area. All right? So this is how you expand your viewfinder. Okay, expand your viewfinder, see the whole patient. Because your patient when they come to a doctor, you included, they're looking for wellness solutions. They want to get well. That's why they go to a doctor, right? What do you go to the doctor for? Oh, really? Now, my patients come to me because they don't want drugs. All right, so I guess depends on what sign you put out. Drugs available here. So let's start to widen our viewfinders because your patients really want to come to you to buy health and wellness solutions. Okay? They don't know what you know. So it's your job to educate them, train them. So I have a particular soft spot for bicuspid extraction victims. These patients suffer what I call triple whammies. Not only did they have to go through braces during their teenage years, they got shortchanged by 4 or 8 teeth, okay? Now what happens? They have to pay to undo it again. That is if they're lucky. They find you trained to recognize this, okay? These patients always suffer more than anyone else. This is a patient who reached out to me from Perth, Australia. From a standpoint of cosmetic dentistry, this is a raging success, right? You can't do better than that. You can get on People's Magazine with this, except for that spot of mercury, right? But you're her presenting complaints. Unable to breathe fully ever. Hugely painful, limiting, and infuriating. This pain. She almost committed suicide several times. She didn't only because she kept thinking that there had to be a better way. And sure enough, once I had a diagnostic workup, that's her airway. When the orthodontists in the dark ages of dentistry took out 4 bicuspids, did they also write on their prescription, make the tongue correspondingly smaller? All right? If they didn't, they aggravated this. Okay? These patients suffer more than anyone else. If you want to be busy full-time, just say, I treat bicuspid extraction victims. And your practice would be full of them. Look at the presenting complaints. Pain, teeth grinding, wake up multiple times a night, can't go back to sleep. Adult teeth extraction with braces as a teenager, and then braces again as an adult. And look what happened here, despite the lingually bonded retainers. This tongue had to break that lingually bonded retainers in order to what? Keep her alive. So it doesn't get stuck back here. That's what happened. G-bruxing, yeah. So teeth grinding is not just a dental issue. Teeth grinders suffer from many other symptoms that I call impaired mouth syndrome. Okay, here are 8 of them. Just do a checklist for yourself. See how many of these you have. All right? I mean, I've had 20-year-old young man says, I have all but one, high blood pressure. And I said, well, I'll give you 15 years and you'll be there. Your patients are actually turning blue waiting for you to show up as an airway mouth doctor. Meanwhile, their teeth, their neck, their back, their heart, their brain are just paying the price. We all know about abfractions. We all know about how sensitive they are. We know about chips and fractured cusps and all of that. What we don't know is why, until recently. So I said to you earlier that when I got to dental school as an engineer, teeth grinding just didn't make any sense to me. I mean, why should the body destroy the hardest tissue it has? Well, 35 years later, because this question kept nagging at me. Every chance I got, I went and took some courses. In, out of dentistry, you name it, I did it. And here's a one-line answer. Teeth grinding is one frame in a movie, and the movie is not called centric relation. The movie is called airway obstruction during sleep. The body's trying to rescue itself and sacrificing teeth for a higher cost. That is to get oxygen to the rest of the body. Okay? So, let me ask you, what percentage of your patients have teeth grinding in your office? Somebody throw out a number. 80, 90%. You guys are good diagnosticians. You guys are good diagnosticians. Yes, I agree. Thank you. So here's proof that teeth grinding is related to airway obstruction. Okay? During CPAP titration, teeth grinding stop as soon as there's enough oxygen going through to the lungs. I want you to think about how much untapped revenues are there from undiagnosed cases in your practice. So far as impaired mouth syndrome is concerned, and just on teeth grinding alone. All right, 80 to 90% is a huge problem, and yet in dentistry, we don't have a good answer for it. Your patients want health and wellness, okay? And you have patients who have aches and pains. You have patients who have one dental trouble after another. You have patients who have failed root canals and implants and orthodontic relapses and stuffy nose and snoring. We didn't even look into the other medical problems that got dental comorbidities. So, here's another case, right? This is commonplace. They have a mouthful of what? Very little for you to do, right? But they got an airway problem that we're not seeing. Look at this. Beautifully maintained teeth. Miserable patient. Okay? What's his complaint? Right here. Teeth grinding, homeless bite, concentration in the mouth, pain in the hip and the lower back. He is dying for somebody to hear him. Once I told him, with this, I can solve your problem, he's in. Now, you could adjust that upward or downward in your zip code, but the issue is, how much are you helping this patient? I think every night guard is a missed opportunity to assess the airway. You just go back, tell your patient, you remember that night guard I gave you? Let's take a look again, because the earth is now round in dentistry. I'm going to run through this fairly quickly here. It's going to look like a movie. 4 years after the braces came off, she came up and came into my office with a night guard ground through, okay? And I said, look, there's another way. Would you be interested? He said, there is. So they went for it, mom and daughter. So this is what happened when you make the right diagnosis. 5 years. She was 17 years old. Can night guard do this? This? This is what I mean by you get to become a dental facial architect. That's because we tripled her airway. She became a part-time model. On the other hand, if you don't do this and you put implants in first, okay, these are 2 implant supported bridge. The dentist called me and said, she broke my anterior bridge for the 3rd time. That's a panoramic x-ray. He is a very compliant patient. She did everything the dentist told her. But that's her airway. No wonder. So here's the important thing for those of you who do implants in your practice. This is one study, one dentist who did 10,096 implants. They found using AASM, American Academy of Sleep Medicine, criteria for bruxing, that implants fail in 4.6% of the time. Bruxers have 3.3 times the higher risk for implant failure. Now you know why this is failing in this patient. Here's a patient who is in his mid-70s. That's his airway. He's lucky he made it that far. But along the way, he paid a price. History of radical prostate surgery. So we gave her this treatment. And if you want to avoid implant failure, you want to control bruxing, and you want to address the airway first. He's a retired senior, so I only charge him basically my overhead over 3 years' time. And this is what he has to say. Maybe I won't play this because of the interest of time. Suffice it to say, his neck and shoulder pain got better, and his AHI went from 16 to below 5 and sometimes 0. Okay? Here's the literature. 4 studies that basically says that teeth grinding is related to disturbed sleep in OSA patients. So don't just fix these abfractions. And it's not from toothbrushing. It's from doing CPR to resuscitate the patient himself or herself during sleep. Here's a pilot. He does not want to fail his FAA license renewal. Here's what he has to say. The oral device does not disrupt my sleep at all, but my CPAP does. I've started having nightly dreams now. Okay? 12 months. You can see that the lower anterior is starting to line up. You can see the buccal overjet start to show up. That means the mandible is starting to fit into the maxilla now. That happens because we do the 3D jaw diagnostics. You can't do without it. Here's another low back pain case. She came to me just before the pandemic lockdown. She said, they canceled my elective hip replacement surgery. You help my friend with her low back pain. Can you help me with my hip? She said, I can only sleep 2 hours at a time because of the hip pain. And notice her midline's off. This midline is off because she had beautiful dentistry turn that locked in her midline into discrepancy. Okay? So maxilla and mandible is not aligned, and therefore the neck pays the price, and it's like a whip, right? A little bit off there at the tip, big. That's why her low back pays the price. And she sent me this. Hip hip hooray, 08 last night, I can sleep through the night now. So this is a great joy. For me anyway, I love doing this kind of things. I like to go to bed for patients. That's our airway. You diagnose what's off, where, and how much, then you can target it with your appliances. Parents, they want to do this for their kids. Just show them that you know this, that this matters. Everyone, you sit up straight for me, please. Do a little exercise yourself. So open and close your mouth into your maximal intercuspation in the back teeth. Now tip your head to one side. Oh, do the same thing. Open, close. Where did you land earlier? The lower side. Now do the same thing. Tip your head back. Open and close. Stop there. Now level your gaze. Do you have an anterior open bite now? You should. Okay? So your head posture is intimately related to your occlusion. Here's a chiropractic neurologist. Published an article called Totem Pole Hierarchy of Survival Reflexes. Guess who's on the very top? Mouth doctors. Okay? That's consistent with what I'm trying to say, which is that I can only use 3 colors here before it gets too complex. Green is air, red is circulation, yellow is digestion. All right? Health and wellness starts with us, in the mouth. Alignment, airway. Speaking of alignment, does it matter? Yes. When I was a biological dentist, I used to think, oh, scoliosis, that's somebody else's business. Not anymore. So we did this. Look at what happened. Thank you. 9 months. This is causation fix, okay? Because we make this diagnosis, we use the same appliance and we combine it with PT. We take the oral contribution out of the body and let the PT do her work, then it will hold. Yeah, postural restoration therapist. Yeah. But we had to do our part. In fact, the PT referred this case to me. Now, this is interesting. She happened to wear the same T-shirt, okay, 9 months apart. All right? She's feeling way more confident. So you can head off patients' pain and suffering way ahead of the time. Sleep apnea are just outcomes, right? What are the causes? This one doctor went back before she even finished training, started 51 cases in 2 months. It's not about making money. It's about getting well paid for services well rendered for making a positive difference. Teach them what their body is desperately needing. For me, what makes my heart sing is seeing patients show up like this. Okay, this is 10 months. Come back happy. Pain's gone. Oh, my neck and shoulder back pain, I can't remember the last time I had it. So it doesn't mean you give up dentistry, but it does mean that you start looking at the patient, and maybe you want to take on additional training to see the patient so that you can help make a bigger impact for them. So with that, I want to thank you for your attendance and your interest, and I'm happy to take questions afterwards.